My name is Mackenzie Roach, and I'm going to be Googling premature baby and looking for healthcare websites. First, March of Dimes, a .org domain, and it's not a personal page. There's no tilde. It's a nonprofit working to improve the health of mothers and their babies, not regulated by the government, but backed by many healthcare professionals and universities. They have been a top women's and infants health organization that's been around for 80 years, and they work with big universities like Stanford, Washington University, University of Pennsylvania, Duke, and more to research and find improvements in women's and infants' health. There's their link to donate since they're a nonprofit. March of Dimes has an unbiased, informative view. The webpage is sponsored by the owner, March of Dimes Foundation, a nonprofit organization to support the health of women and children. There are no ads, only links to other March of Dimes articles. At the bottom of each webpage is a link, Contact Us. There is a physical address, a phone number, and a form to email them. The titles and verbiage of the articles, seen in the right menu, are straightforward and informative. No capital letters or exclamation points. You can tell their purpose is to educate and promote women's and infants' health. They have great resources like this video. None of the articles are improperly promoting a position or product. They are just trying to inform people about premature infants. This article was last reviewed in October 2013. All of the web pages I have skimmed have been reviewed within the last 6 years, with most of them reviewed in the past year. The sources are not cited on this page, because the source is March of Dimes, not a single person. March of Dimes is credible, and backed by many credible universities, but they should think about adding author names to increase their credibility and help the readers understand this information is written and reviewed by medical professionals. At the top of the page is a menu, and under the Our Cause tab is an Our Mission page with their About Us. Their About Us page includes their history. They've been around for about 80 years, how they started, the polio vaccine research, and what they're doing now. Educating professionals, supporting research, and helping families. This page is published by March of Dimes, a nonprofit working for better outcomes for women and children. They started as the National Foundation for Infantile Paralysis. Today, they educate professionals and families, support research, and advocate for women and infant health. March of Dimes is a known organization for women and infant health. They have continued education for perinatal nurses, and they work with Stanford, UPenn, and many other academics and healthcare professionals to conduct research. No grammatical or spelling errors seen on this webpage. There are no footnotes, bibliographies, or references on the webpage, but they do have a last reviewed date at the bottom of each informative webpage. The links work. Their information is based on sound research. I know because their About Me page says they've worked with many universities to research and find ways to improve women's and children's health. But there is no indication on the article itself that it is written and reviewed by a professional. If it is accurate, credible, and written by a healthcare professional, which they state in the About Us page, March of Dimes should add the author's name at the bottom of the webpage. From what I've learned in clinical and my maternity textbook, all of the information I have looked at is correct. There aren't any product or position ads. They're just advertising and informing people how to safely care for women and babies. I think March of Dimes is a good resource for patients and their families. Let's go back to Google and look at Medline Plus, a government domain with no personal domain or tilde. Medline Plus is run by the U.S. federal government. The U.S. National Library of Medicine, overseen by the National Institute of Health and the U.S. Department of Health and Human Services, published Medline Plus. It's backed by the NIH, probably the most known and credible health organization, since it's the main guideline for health in the U.S. This government website is made for patients and family members to use. It's reliable, up-to-date health information anytime, anywhere for free. Each summary of information is cited. i.e. the CDC is cited on this webpage, and each resource or article is cited next to it. It covers all areas of health: treatments, medications, diagnosis, explanations, and more. All of their information is based on medical research. They credit the CDC, multiple pediatric journals, and even March of Dimes as their sources for their articles, journals, and information, which are all credible, accurate, reliable sources. They also offer information in Spanish and many other languages. Let's look at some of the resources they have posted. At the bottom of each topic page, it tells you the last time the site was updated and the last time it was reviewed. Most of them have been updated within the last 5 years. This one was updated in 2016. So the links do work. At the top is the About Us link. On the page, it states that it's an NIH website that offers reliable, up-to-date, authoritative information about diseases, illnesses, wellness issues, and the latest treatment on one easy-to-search free website. Also at the top of each page is the FAQs and customer service link. I cannot find a phone number or email address to contact them, but they do have their physical address in a large FAQ database. I did not spot any grammatical errors. This website has a wide range of information, offering multiple viewpoints and solutions to medical issues. There is no advertising on this site. There is no positions or products being promoted other than good health. There are no capital letters or exclamation points. This webpage is straightforward and informative. The information is up to date. On their topic page, they have links to the CDC's most recent stats, to current clinical trials, to specific articles that were written, updated, and reviewed within the last 5 years. Medline Plus is a great resource for patients, nurses, and family members to use in any medical situation. Now let's go back to Google one more time and go to Parents, a .com domain that's not a personal page, no tilde. The .com is not a very good sign for getting accurate, credible medical information. This page is supported by the Meredith Corporation, which manages many media and magazine sites and companies and is not a medical organization. Some of the articles use capital letters, exclamation points, and ... to catch the reader's attention. The titles of the articles are definitely made to play on emotions and catch your attention, but not as focused on informing you what health benefit or topic is going to be covered in the article. This article is posted by Holly Ackman Becker. She is not a healthcare professional. She is a freelance writer. Many of the articles show multiple viewpoints, but there are a fair amount of articles that only have one point of view, especially the articles that are more testimonies than informational articles. While some articles insert links to professional journals and papers, there is no proper citation or credit given. Most of the articles seem like a normal, non-medical professional interpreting what they have read in a professional, credible article or journal. There is no date on the page, no date when the article is written, no date when the page was last updated. There are no dates about anything. Parents.com makes a magazine called Parents Magazine. It's relevant to look at because it's one of the first websites to pop up when you search premature babies. There are multiple ads on this website at the top of the page and throughout the article links and to the right of the articles. While the articles themselves are not improperly using data to promote position or placement or advertisements, there are Parents.com and Parents Magazine advertisements scattered throughout the articles. Parents.com does not produce its own research, but it does try to keep up with the recent happenings and trends in newborn care and parenting. Many of the posts are linked to news articles dated in 2017 or 2015, so there's definitely some updating that needs to be done. They have articles about deliveries with newborns still in the amniotic sac from 2015, which is newer but still 3 to 4 years old. The About Us page is very hard to find. It is only on the home page at the very bottom. There is an About Us page that has about 3 sentences of information and has no information about the credibility of the information. Their purpose is to help parents raise their kids in a healthy and fun way. I cannot find a physical location for their company or even a Contact Us link. I can search contact info and dig to find contact information, but I only found an email address. The links on parents.com do work. I didn't notice any spelling or grammatical errors while skimming the site and articles, but I did notice that some articles have added unnecessary emphasis to some titles and intros, like capitalizing every letter in a word and adding exclamation points, seen in the Science Proves You Can't Hold Your Baby Too Much article intro. There are no footnotes, bibliographies, or references at the bottom of these articles, only random links to credible websites inside the article. Just because there is a link doesn't mean the article author, none of whom are medical professionals, is resharing that information accurately or without bias. This website is a poor source of medical information, and we should discourage patients from using it. In summary, we should tell our patients that if they're looking for medical information, they should look at a .gov or .org website, not a .com. MedlinePlus.gov is a great resource for any health information that any nurse can tell any of their patients to use, with access to information in other languages as well, which is great for our Spanish-speaking patients that we see so much in Texas. March of Dimes is also a credible organization in terms of maternal, neonatal, and infant health. And they have a lot of great information on a very organized website with great resources like videos and printouts. It's important to know credible sites and resources so we can help our patients find and learn the correct information, whether they're in the hospital with us or looking up this information at home with their families. And here are my sources. Thanks for listening.